Psychiatric service dogs are a category of service dogs that assist people suffering from mental health conditions. They can be a life-changing addition to treatment of several disorders that affect one's quality of life and help their handlers better navigate and manage their condition. A psychiatric service dog is trained to perform tasks to relieve symptoms related to mental health disorders, including anxiety, depression, PTSD, and more. Some service dogs are exclusively psychiatric service dogs, but it's not uncommon for medical alert and mobility dogs to be used for psychiatric purposes as well. It all depends on the needs of the owner and the training they receive. Differentiating between a psychiatric service dog and an emotional support dog is incredibly important. Both types of dogs can be a great addition to someone's life, providing comfort and companionship to their owners. The key difference is that emotional support animals provide this comfort to their owners just by existing and are not expected to perform any specific tasks or be trained for public access. Psychiatric service dogs are especially trained to perform tasks that mitigate their handler's mental disability. They are legally allowed in pet-free public spaces under the ADA, which means they must be trained to behave properly in public. Emotional support dogs are not permitted in pet-free public spaces, but can live in pet-free housing. Additionally, emotional support animals in general are not limited to dogs. Here are some common tasks psychiatric service dogs learn to help mitigate their handler's disability. Deep pressure therapy is a form of tactile stimulation and grounding. The dog applies gentle and firm pressure on the handler's body to calm the nervous system. This is typically done by laying on the owner's body or leaning on their legs. Grounding and intervention tasks are when the dog is trained to detect physical signs of distress and intervene by pawing, nudging, or licking. This is effective for panic attacks, dissociative episodes, flashbacks, and nightmares. The dog's intervention not only helps bring their handler back to the present, but it also helps them better understand the physical symptoms of their condition, which can vary greatly between people with the same condition. Service dogs can also be trained to retrieve medication during episodes of anxiety, panic, and PTSD. They can be trained to retrieve a bag from a specific location, or even open cabinet doors and retrieve a purse or bag containing medication. Some dogs can be trained to fetch a beverage to help their handler take their medication. This is a complex skill that takes several months to master. Dogs for anxiety disorders and PTSD can be trained to perform positional commands to create space between their owner and the public. For example, a dog could be trained to stand behind their handler's legs to create a physical barrier between them and the people passing by, in a grocery store, a checkout line, or similar places. Other tasks can include locating exits for when their handler is experiencing emotional overload, providing balance assistance for people who experience dizziness or weakness due to certain medications, and switching light switches and picking up items for people suffering from depression and OCD. Training a psychiatric service dog is a long and rigorous process. Here is an example of how anxiety alerts, a common task for this type of work, can be trained. The first step is to teach the dog the touch command. A trainer will hold their hand out flat and reward the dog every time their nose makes contact with their hand. After repeated successes, the trainer will begin associating the word touch or a similar verbal cue until the dog understands the command. The next step is to place the command on a target area, such as the leg. The trainer will hold their hand on the target and repeat the command until the dog understands to touch the target. The trainer will then slowly integrate an anxiety symptom in with the verbal cue. For example, the trainer will begin bouncing their leg, then give the verbal command to associate the two. The verbal cue will then be phased out until the dog understands to perform the touch command when their handler's leg is bouncing. A lot of training for other tasks involves similar processes of repetition and association, always using positive reinforcement. The most common breeds used for psychiatric service dogs are Labrador Retrievers, Golden Retrievers, and German Shepherds. These breeds are typically used because of their natural intelligence and trainability. The Retrievers in particular are also very friendly by nature. German Shepherds are known as great watchdogs and are very loyal. Any type of breed can technically be a psychiatric service dog, and some organizations exclusively train rescues of all different breeds for service dog work. But these breeds have been some of the most widely and successfully trained. Other common breeds for this type of work include poodles, border collies, and Bernese mountain dogs. Smaller breeds such as Yorkshire Terriers and Havanese can also be used, but these breeds won't be effective for deep pressure therapy or mobility tasks. In general, the limited studies done on the impact of psychiatric service dogs has been very positive. Specific accounts from handlers have revealed increased independence, reduced anxiety, less severe panic attacks, and increased sense of safety. The handlers clarified that their dogs do not eliminate the need for other mental health services, such as therapy or inpatient stays, but they do help to reduce the severity of episodes relating to their conditions. Some handlers also note that strangers are much more likely to approach them and their dogs, possibly asking invasive questions or starting an argument. These interactions can lead to increased stress, especially if the handler suffers from social anxiety. Depending on how the condition affects you, people with severe social anxiety might be encouraged to look at other forms of treatment before pursuing a service dog. Some people wanting to bring their emotional support or pet dogs with them to public spaces might use a service dog vest. This might be done to bring a dog on a plane, take it to a store, or keep it in pet-free housing, or other similar reasons. This is a huge ethical issue as the dogs aren't trained for public access. This can hurt real service dogs and their handlers by diminishing the reputation of real service dogs and cause more questioning in public. The practice of fake spotting is also quite complicated because while there can be many signs a dog might not be a service dog, it's hard to be 100% sure. The fake service dogs also may experience distress being out in a public space without proper preparations and training. A dog without proper training may also display distracting or even aggressive behavior toward real service dogs. In some cases, service dogs develop fears of other dogs because of these encounters and seriously impairs their ability to work. Psychiatric service dogs may be more likely to be accused of being fake because their handler's disability is not visible to strangers. Handlers might also be more hesitant to explain the purpose of their dog to strangers because of the stigma around mental health conditions. In any case, asking about the handler's disability to grant access to a space is unlawful under the ADA. In conclusion, psychiatric service dogs can be an effective addition to treatment of several mental health disorders. They can be trained to perform tasks that mitigate otherwise debilitating symptoms, granting their handlers more independence and security. Despite some downsides related to public interaction, overall experiences with these types of dogs have been overwhelmingly positive.